So by way of going down memory lane or history, ancient history reveals an active role of women in surgery, and this spans through places like Egypt, Italy, and even Greece. And some of these details have been captured in old medical texts. The very first female that became a surgeon uh, was Elizabeth Blackwell. Dr. Elizabeth Blackwell became the first woman in the United States of America to be granted a medical degree, and that was in 1849. She began her pioneering journey after a very ill friend of hers insisted that she would have received a better care from a female doctor as against the care she got from male doctors at the time. So that was what spurred Elizabeth Blackwell into her journey in surgery. Then the next female surgeon was Dame Louisa Aldrich Blake, and she was Britain's first female surgeon, followed closely by Dr. Dorothy Clenk Nash, and that was in 1928. And she became the first female neurosurgeon in the United States of America, and she maintained her status as her country's only female neurosurgeon until 1960. In Nigeria, the very first female general surgeon we had was in 1973, and her name was Dr. Stella Adekbero Adeoba. She was followed closely by Dr. Nene Obianyo in 1974, who later became a professor of pediatric surgery. Why am I reading out all these names to you? I'm doing that so that you see that as far back as 1973, 1974 in Nigeria, women already claimed their position as surgeons. So it shouldn't be a new thing, or it shouldn't be a scary thing for any one of you here to become female surgeons going forward. Let's bring the story closer home. One of our very own, Dr. Salamat Ahoiza Aliu, became the first indigenously trained female neurosurgeon in Nigeria, and also the first female to be certified as a neurosurgeon in West Africa. She did not only make this history as a single individual. Let me shock you by telling you that in her family, she has 4 other siblings, all females, who are also surgeons. Well, one isn't a surgeon, but of course, she has a sister who is an obstetrician and gynecologist. She has a sister who is a plastic surgeon. Then, of course, she has a sister who is a community physician, and I think there is still one more surgeon in the family. So all 5 of them are females. They are doctors. They are trailblazers in their own rights, and you too can be a female surgeon just like them. Then of course we have Abimbola Ayodeji Abolarinwa also as the next female. She's actually the first female urologist in Nigeria. Coming to the field of orthopedic, world over, the very first female orthopedic surgeon happened to be Dr. Ruth Jackson. She was certified by the American Board of Orthopedic Surgery in 1937. And that was the first time a female was admitted into the American Academy of Orthopedic Surgeons. Having said that, right here in Nigeria, we also have pioneer female orthopedic surgeons. Those females that helped us to till the ground of orthopedic surgery in Nigeria are Dr. Udo Anyehi. I think presently she's with the teaching hospital in Enugu, where she's doing great things in the field of orthopedics and also in the field of arthroplasty. And then, of course, we have Dr. Temilolua Olufemi, who is with the National Hospital Igbobi, National Orthopedic Hospital Igbobi, and she's doing great things in the orthopedic space in Lagos. In fact, nationally, she's doing a lot, both in both colleges, both the National College, the West African College, and also in CICOT. That is the Society for International Trauma and Orthopedic Surgery. And then, of course, we have Dr. Peace Amare Gulam. She's also at the teaching hospital in Umuahia, and she's doing great things, especially with her foundation, where she deals with cerebral palsy and other congenital orthopedic conditions. Then we have others whom I may not be able to mention all of them, but I want to assure us that there are many women in orthopedics right now, and they are doing great things. We have Dr. Kemi Lawani in Cedar Crest Hospital here in Abuja. We have Dr. Dakre Mabo. She happened to be the first female orthopedic surgeon in Rivers State. And right now we have a plethora of senior registrars in the field of orthopedics, and also several female registrars in the field of orthopedic. And the future of orthopedic is looking good. And I believe that as we go along, some of you may end up becoming orthopedic surgeons.